Stopping your medication abruptly may not just unpleasantly affect your condition, it can be outrightly dangerous. Wait. All is not bad as it may sound. There are certain class of medications which needs to be stopped as soon as the problem or the health issues goes away. In this video, I'm going to tell you about what you need to consider before stopping any medication and the right way to do it. Also understand the difference between acute and a chronic therapy, and finally understand this concept of deprescribing. So let's roll. Welcome to Lucid Medicine. I'm Dr. Rahul Joshi and I attempt to explain medical concepts, diseases, medical terminologies in a simple way so that it is understood by all. So subscribe, like and share to spread health literacy. Coming back to the topic, can I just stop my medicines? In many cases, this question is not even asked or considered. The patient just stops the medicine, deciding that it is not making any difference or associating them to any side effects or having difficulty at all to pay for the meds. So which group of medicines are not to be stopped abruptly? The examples of group of medicines that should be gradually ceased belong to the class of antihypertensive, blood thinning agents, anticonvulsant medicines, antidepressants, heart medicines like beta blockers, calcium channel blockers, etc., antipsychotics and long-term corticosteroid therapy. Abrupt termination of prolonged therapy with certain medicines has a potential to cause serious consequences. The risk of discontinuation and severity of symptoms will depend on the medicines, the duration the person has been taking them for, the dose and the rate at which the dose reduction is happening. Now let us discuss the other part of the story. Which medicines can be abruptly stopped or need not follow a particular regime to stop? Although this question looks quite straightforward, it is actually compounded with many intricacies. Quite a lot of medications can be withdrawn abruptly, but they may come with some minor or major physiological effects. These effects may be due to one of the several possibilities. To follow what I'm saying clearly, here I have few examples. The body being used to a certain level of medicine in the blood for any condition and now not getting it means the condition is being noticed again. Okay. The simple example of this particular scenario is a long-standing use of paracetamol in osteoarthritis. If it was supposed to be suddenly stopped, I don't think one would get true withdrawals from this, but the patient would definitely notice the increase in the pain. In a nutshell, if you stop a painkiller, pain will pop its head up and causing again discomfort. Another example are the nasal drops containing oxymetazoline and hydrochloride. They are good for symptomatic relief for runny nose, nasal secretions. But once you stop, it leads to rebound rhinitis and secretions. Whereas its continuous use may lead to damage to nasal mucosa like drying and chafing. Antibiotics, once the course is completed, it should not be continued any further unless your doctor recommends you to, and that is also for a very specific indication. Talking of doctors, let me introduce you to another concept called deprescribing. You very well know what a prescription is and what does it contain. If you want me to make a video on that, let me know in the comments below. Okay, so deprescribing is the process of withdrawal of an inappropriate medication supervised by a healthcare personnel where the goal of managing polypharmacy and improving health outcomes. Deprescribing is a structured process with the consent of the patient or carer explaining the rationale and steps if the symptoms reoccur. Deprescribing also gives information about alternative non-drug strategies that may use to control symptoms. A written tapering plan is desirable, especially for the classes of medication that require slow tapering to avoid either return of the disease symptoms or withdrawal symptoms at times. The examples are steroids, opioids, antidepressants, anticonvulsant medicines for hyperacidity, etc. This has the potential to optimize the person's quality of life by reducing medications that are no longer appropriate or required. There are many studies to show the benefit of slow, appropriate reduction of inappropriate medicine. Before I end the video, I want to share just 3 questions that you need to ask before stopping any medications on your own. Question number 1, do I know what should happen or what would happen if I stop taking this medicine suddenly? Question number 2, Am I really aware of the discontinuation plan, that is dose schedule, substitute, or any other SOS medicine or emergency medicine? Question number 3, am I stopping it for the right reason and adequate rationale? Do think about it. There are many aspects like age, comorbidities, modified drug release formulations, surgical procedures, etc., which are attached to this decision making. Thus, it is advisable to reach out and recheck with your doctor about deprescribing. Time to end the video. Thanks for watching. This is Lucid Medicine, reimagining medicine in a simpler way.